All right, good morning and thank you for joining us for today's Manulife Business Success Series webinar on mental health at work during COVID-19. My name is Hannah Kelly and I'm the events coordinator of the Greater KW Chamber of Commerce. Before we get started, I would like to take a moment to acknowledge that we live and work on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples as we seek a renewed relationship based on the foundation of mutual understanding and respect. Today's session would not be possible without the continued support of our sponsors. Our title sponsor for the Business Success Series is Manulife. Our platinum sponsor for the series, Immigration Partnership, and this month's presenting sponsor, TD Bank Group. These organizations are committed to supporting our local economy and providing businesses with the resources and tools they need to thrive. I would now like to welcome Eric Pfeiffer, Senior Health Management Consultant with Manulife, to say a few words.
Thank you, Hannah. On behalf of Manulife, I'd like to thank everyone for joining us today. We are proud to sponsor the Business Success Series, which offers our community a fulsome learning experience by industry leaders on a diverse set of topics. Today's topic on mental health for the family is a timely one, and something that has come to light even more so during the pandemic. I'm pleased to say that Manulife has been able to support our customers and employees during this difficult time with mental health resources. We are the champion of excellence for mental health at work through Excellence Canada. We do this to help promote great mental health. We believe that promoting mental health and well-being is vital for all Canadians. In fact, at the start of the pandemic, Manulife sponsored Stronger Minds by Beacon for all Canadians. This program was created to support all Canadians through the heightened stresses related to COVID-19. We also created a COVID-19 Return to Work playbook that includes a section specifically on the mental and social well-being of workers, as we know the impact of the pandemic is more than just physical. During the pandemic, we've also seen a huge increase in our virtual wellness sessions on topics like self-care strategies, reducing anxiety during the pandemic, building resilience, mindfulness and meditation, and foundations of positive parenting. This is a clear indication that these topics are front and center for both individuals and employers. Manulife also has a mental health portal at manulife.ca, which has resources for both individuals and employers looking to support employee mental wellness. This portal has an abundance of resources from education, prevention strategies, manager training, and community resources. Needless to say, I look forward to the presentation and discussion today, and I'm positive that there will be some excellent takeaways from the session. And with that, I'm going to turn it back over to Hannah.
Thanks, Eric. We're thrilled to have Manulife on board with this series as we work to support local businesses during this time. Just before the session starts, I'd like to go over a few quick reminders. Please ensure that your microphone is muted throughout the presentation so we can reduce any background noise. If you have any questions that come up throughout the session, you can type them into the question box in your control panel at any time. If they are tech related, a representative of our team will get back to you momentarily. If they are for today's presenter, they will be gathered throughout the session and our speaker will do their best to answer as many questions as possible following the presentation. All attendees will be sent a recording of today's presentation and it will also be made available on the Greater KW Chamber website. I'd now like to invite Kenda Allen, Vice President of TD Commercial Banking, to introduce today's speaker.
Thank you, Hannah. It's my privilege to be here today and for TD Bank to be the presenting sponsor of this September Business Success Series. And like Manulife, today's topic is one that we take at TD Bank, we take very seriously, and making sure that the well-being of all our colleagues is looked after. So I have the privilege today of introducing the speaker. For over 25 years, Helen Fishburn has worked in numerous roles in mental health and addiction field, including various roles for the past 18 years with the Canadian Mental Health Association, Waterloo-Wellington. Helen is honored to be the Executive Director of CMHA WW, as it allows her to drive care systems change forward while overseeing care for people of all ages with complex needs. The creation and implementation of HERE 24/7, a coordinated access center for all mental health, addictions, and crisis service in Waterloo-Wellington, as well as the Impact Police Crisis Program, are some of the defining achievements in Helen's career. More recently, Helen led the creation of Here for Healthcare to respond to and support the mental health needs of our healthcare workers during the COVID-19 pandemic. In 2016, Helen was honored to receive the Guelph Women of Distinction Award. If you ask Helen, her true pride and joy is her family. Her husband and her 2 children keep her grounded and ever grateful. Helen holds a master's in social work from the Wilfrid Laurier University. Please join me in welcoming Helen Fishburn to speak to us today. Helen?
Thank you so much. It's lovely to be with you all, and I really, really appreciate the opportunity. Anytime we get to come and talk about mental health, it's a good day. And as Eric said in his introduction, now is a great time to be talking about mental health, given the impact that the pandemic has had on every single one of us. So I really, really appreciate the opportunity to come and talk with you. As Hannah mentioned, I do have a number of slides, and I thought I'll try and go through them as quickly as I can and give you a bit of a baseline information about mental health with a particular focus on the workplace. And then I'm happy to answer any questions that you have. And I'm also happy to share my email if anyone would like to be in touch with me outside of this presentation as well. So obviously we start with the basics. What's mental health? Certainly how a person thinks and feels and acts when faced with a life situation is mental health. It's that simple. How we respond to life, how we manage life, and that certainly affects how people evaluate challenges, problems, and explore choices and make decisions. And it, of course, imbues how people see themselves, which, as we all know, can change every day depending on how we're viewing the world and how we're feeling within ourselves. How would you define mental wellness? So I'm just going to actually move this. So when you think about mental wellness, that's something, it's a concept that not everybody thinks about in a conscious way. But certainly when you think about mental wellness, there's a continuum, and people can feel quite well, and they can certainly feel quite distressed. And this is life. This is how we manage life every single day, and it's fluid. There are days that we get up and we feel well and we're ready to tackle the world, and there are other days when we get up and we're quite distressed. And you know, some people call that you get out of the wrong side of the bed. Other people call that you view life half empty rather than half full. But certainly every day is different depending on many number of factors: the weather, our financial status, our relationship status, how we're feeling at work, how we're feeling physically. It is fluid. Certainly there are things that we can do to promote our wellness and take care of ourselves, you know, going for a coffee with a friend, going for a walk, having some family time. And there are things that also can promote our distress as well. And those are things like feeling the pressures of a financial situation, or job loss, or relationship problems. And certainly people can live in that space where they're really, really struggling, and they can also live in a space of wellness. And that's, again, just life. Every single person, if you have a pulse, you're on this continuum somewhere. What comes to mind when you think about illness? It's a little bit different. And illness is certainly a state, no illness is a state where somebody does not have a diagnosis of a mental health condition, so they've not been diagnosed with anything formally. And then, of course, illness is the complete opposite, where you have been diagnosed with something formal, whether that's schizophrenia, bipolar disorder, depression, and anxiety, which are the two most common mental health diagnoses. And again, there's a continuum. There might be people that have a diagnosis that they have lifelong. And then there might be other people that, because of a life circumstance, like the loss of a marriage, or they're grieving someone who has been very close to them and that grief hits them very deeply, they might enter into a state of depression or anxiety and live there for a period of time, even for a year or more, before they're able to come back to a place of no illness. So the most important thing about this slide is to know that it is a continuum, and that people will go back and forth on this continuum as well. So when you put both of those continuums together, when you look at wellness and distress, and illness and no illness, I'll just give you a couple of examples of how this works in real life, and just to illustrate the point. So when you look at Jana, for example, Jana's in that first quadrant where she's well and doesn't have any illness. So she's feeling great. And for most of us in life, most of the time, we live in this quadrant. Now, we'll take the pandemic out of that, because the pandemic actually does change this. But in regular life, most people live in that quadrant where they're well most of the time. Chris doesn't have a mental illness, but he has really been struggling lately, and really struggles with feelings of sadness. He gets overwhelmed. He gets quite fearful about life and what's happening. He can get quite worried, and he's not coping well. So even though he doesn't have a diagnosable illness, he does feel quite distressed quite a lot. And that actually is more of a pandemic natural resting spot for folks. A lot of people are feeling quite identified in this quadrant through the pandemic. And then we go to Erin, who has a bipolar disorder. So there is a diagnosable condition, and she has been experiencing depression for the last few days or weeks. So she hasn't been feeling well as a result of that illness as well. So she's in that lower quadrant where she's experiencing illness and distress at the same time. And unfortunately for people with a diagnosable mental health condition, that is a reality. They can feel like they've got the illness managed, or they can feel like the illness is quite active and they're not doing well. That's actually true of any physical health condition as well. You know, for people with cancer, for example, if they're in an active state of cancer and they're not well and they're taking medication which doesn't make them well, those are real struggles for people with physical health conditions as well. Or we go to the other quadrant, the last quadrant, which is somebody has an illness, but they have that illness under control and they're coping well. And at this particular point in time, they have that managed. So this just kind of gives you a sense of the full circle of illness and wellness, and how mental health and mental wellness cross each other. If you can think of what the difference is of that, the difference is that no matter whether you have a mental illness or not, everybody has mental health. So mental health is really that state of being that we're all in, that state of mind and that state of wellness, and that we all manage every single day. Mental illness is that folks who have a very specific diagnosed condition, and even folks that have a diagnosed condition still have mental health. So they go up and down the continuum, and they have good days, they have not good days. Sometimes I think people don't really fully understand what the difference is, because when you use the word mental health, people all say, oh, well, that's not me, I don't have any mental health. We all have mental health. It's just a state of life. If you have a pulse, you have mental health. Whereas mental illness is really those folks that have that diagnosable condition. So I hope that explains a little bit about the baseline there. Just to give you a few fast facts, and as you can see, and again, this is more relevant. I'm just going to move this so I can see it here. So when you look at this 20%, so that's 1 in 5 Canadians overall will experience a mental health problem or illness in their life. So that's 1 in 5. And we'll come back and talk about what that means more as it relates to the pandemic. But when you're looking at that illness statistics, that's 1 in 5 Canadians. 38% of people under the age of 65, mental illness makes up approximately 38% of an illness. So when you look at the whole continuum of illness, mental illness makes up 38% of that, sorry. And then as of 2018, just 6.5% of Canada's total healthcare spending budget goes towards mental health care. And obviously, I don't probably need to explain that that isn't nearly enough. We have some really significant waiting lists for formal mental health and addictions care, both in our region and certainly across Ontario and across Canada. One of the challenges we have with mental health relating to funding is that mental health cuts across many other physical health conditions. So cancer, diabetes, heart conditions, you name it, any kind of surgeries, car accidents, rehab. Mental health is a part of pretty well every other physical health care aspect. So when we look at funding, sometimes mental health is underrepresented in that, and it's certainly underrepresented in the funding. So that's a struggle that we have working in the field, and we are constantly advocating for more funding. So if we just shift a little bit to COVID-19 and our pandemic, and we look at what they call the echo pandemic. And the echo pandemic is really what comes after the full pandemic has happened. And it's been a really interesting trajectory through the pandemic. Initially, when the pandemic hit us in March and April, our numbers in mental health actually went down a little bit in terms of those calls and walk-ins and reach-outs, just because people were so focused on finding out information related to COVID-19 and what was happening and how not to catch the virus and how to keep themselves and their families safe. And of course, you will all remember during those periods of times, we were all sequestered in our homes and kept very separate. However, as the pandemic continued through the end of April, kind of into May, and we got a little bit more comfortable with how to manage and how to keep safe, we started to see our mental health calls climb again, and people started to struggle with what we called quarantine fatigue, just being at home and really worried about what was happening and fear certainly for the future. That has continued really through the summer. And even though restrictions have started to ease and we've started to reacclimatize ourselves to the new world that we're living in, it's not the same, it's different, but we are back out more. Many people are back at work. Certainly we're welcoming kids back to school. This week it looks different, it feels different, but there are people who are coming back to the world. And for a lot of people, they're excited about that, they feel good about that, but then there are still a lot of people who are extremely anxious, worried, and nervous about those changes, very fearful about those changes. So again, there's that continuum that we're constantly managing. There's been a lot of research and a lot of statistics about COVID-19 and how it's impacting us all. Some of the stats recently, and these are from CMHA Ontario, say that about 6 out of 10 parents are concerned about sending their kids back to school. 8 out of 10 people are concerned about contracting COVID-19 still. And while COVID-19 cases have waned, and we've done an excellent job locally across Waterloo region and Waterloo-Wellington, flattening the curve, there still remains worry, stress, and anxiety about that. And I personally don't think that necessarily is a bad thing, as long as the anxiety isn't debilitating for people. We want people to feel a little bit worried about COVID-19, because what that means is that they are keeping their guard up. They are really paying attention to the precautions. They're keeping themselves safe. They're keeping their families safe. So we want that worry to be a positive stress, so that it allows people to keep safe and to keep well. If people are totally relaxed, not worried about it, then they take the foot off their gas, and they start to really ease some of those restrictions too easy. And that was also some of the stats that CMHA Ontario discovered in the last poll, which was about 2 weeks ago. They felt that 83% of Ontarians felt that people are a little bit too relaxed about COVID-19 and need to worry a little bit more to keep those precautions in place. And then 78% feel like people are not taking the full precautions. So it's interesting, people's perceptions on that and their concerns about that. I will say one of the stats that we have talked about quite frequently related to the pandemic is the 1 in 5 Canadians that I had talked about earlier who have a diagnosable mental health condition. And we know that that's been the statistics that we've used in mental health for several years. Because of COVID-19, that number is really looking like more like 4 out of 5 Canadians. And I don't mean to say that 4 out of 5 Canadians have a diagnosable condition, but certainly through the pandemic, 4 out of 5 Canadians are really feeling that distress, that anxiety, and that worry at a much deeper level, at a much more acute level than we have ever experienced before. Of course, we've never been here. We've never been in a global pandemic. So this is new for us. And we've seen the baseline of mental health change dramatically through the pandemic. And those numbers of people needing to reach out to us have been higher than they've ever been before. I'll talk a little bit more about that. But our numbers in terms of 1 out of 5 has really changed quite dramatically. And that's something that's important for people to be aware of and to understand. So coming back to talking about mental health in the workplace, mental health issues in the workplace are the fastest growing source of disability claims, costing Canadian companies between $16 and $30 billion annually. Interesting note about a mental health disability versus a physical health disability. Mental health leaves usually are double the cost of a physical health leave. Physical health leave usually have a pretty prescribed period of time. You have a course of treatment. You have, you're recovering from surgery. There's usually a pretty good sense of what that physical leave looks like and somebody's anticipated recovery. With mental health, it is never that simple. There aren't usually black and white rules or benchmarks around recovery from mental health. Because all of us are on the continuum around wellness, as well as the continuum around illness, mental health is such an individual illness and it's such an individual responsibility. It's really hard to predict how long someone will be off work and how long their recovery might be. So that is one of the challenges that we have related to how to predict the impact of mental health at work. In any given week, approximately 500,000 Canadians will not go to work because of a psychological health issue. So that's a really huge statistic. Some of you guys might have seen the Bell Let's Talk videos, which are so profound and have such an impact during the Bell Let's Talk campaign, which is always in January, where you see somebody calling into work, clearly distressed, not doing well, not coping well, and yet they don't identify that for their manager. And that's stigma. And in mental health and addictions, we continue to struggle with stigma every single day. Still so much easier to talk about a physical health condition like breaking your arm or surgery or asthma. Continues to be extremely hard for Canadians to talk about mental health. We've come a long way with stigma. We are better than we've ever used to be, but it is still very much a factor. I think some of the ways that we are better is that we've had a lot of celebrities and a lot of people who have told their story and have really showed some courage in sharing their personal vulnerabilities, so much so that it is really empowered and inspired people to share their stories. So we are better, but it continues to be something that we struggle with in mental health and addictions every single day. Here are just some signs to look for from an employment perspective, in terms of if you're worried about one of your employees, and you're starting to think of what's different about that person. Here's some ways that you can look at that person and try and understand what's different. Sometimes what we hear from mental health is that it's hard for people to put their finger on it. They know that John Smith or Joan Smith is different, but they're not quite sure why they're different. And they're nervous to ask that person. They're nervous to approach them. They don't want to be intrusive. They don't want to be offensive, but they know something is wrong. And here are some things that might help you kind of put your finger on it in terms of what might be physically different or what's different with their cognitive ability to process information what perceptions there might be there, what the emotional affect might be if the person just looks down, are sad, upset, disengaged, and then what behaviors you might be seeing. Those are ways that we might be able to categorize some of the concerns that we feel. Also, as you all know, mental health impacts an individual's family and home life, as well as their ability to function at work. It's harder to hide that at home than it is sometimes at the office, because as you know, when we get home, we let our guard down and we truly show the people that we live with, whether that's our spouse or partner or our kids or our aging parents who sometimes might be living at home with us. That's where we show our true selves, and people at home are able to really see what's happening, more so than at the office. And again, what we see with stigma is also a big impact at home as well, because oftentimes people's partners and kids want their loved one to get help. They want them to reach out, but it's still so hard for them to do that. I know in our service, and we'll talk about here 24/7 in a minute, but certainly we hear from a lot of families directly and a lot of people's kids and their parents that they're really, really worried about their loved one, but they're not able to reach that person. They're not able to convince them to reach out for help. And in those situations, we actually work directly with the family members to build that bridge with the person, to make sure that they have a place of safety, and to make sure that our family members are supported as well. Because when you're on a mental health journey with someone, it is really challenging for family members to navigate that and walk that. So what do you do? The next few slides are going to focus on how you can support an employee that you're concerned about. And of course, this also applies if you have a family member, a next door neighbor, or anybody in your life, a good friend that you're concerned about as well. And I will say that this continues to be hard for folks. Again, it's so easy to ask someone who has a physical health issue, you know, how's your arm healing? How's your asthma treatments? You know, you had cataract surgery. We're really trying to encourage conversations around mental health and addictions to be the very same way, because mental health is an illness just like diabetes or just like cancer. But because of that stigma and because it's still in the shadows, it is still hard for people to have those conversations. So here's some things to think about. If you can set aside some time to meet with the employee, provide some concrete examples, and I shared some of those in that wheel with you a few slides ago, just about why you're concerned. And again, you don't have to be a psychologist here, you don't have to be a psychiatrist. You can just be someone who is caring. You can say, you know, I really have seen a change in you. You don't seem to be yourself. You seem quite down. You seem quite distracted. You seem quite disengaged. I'm really worried about you. And there's ways to open up that conversation without feeling like you can be, you know, too intrusive, or that you have to go and do a whole bunch of research to try and figure out what is wrong with the person. That certainly isn't your job. Your job is really just to extend that olive branch, or to open up a conversation, trying to open up that door to invite that person to come through the door. And that's where it's really helpful to listen, ask questions, to be supportive. You don't have to have all the answers, but to really just be there in that moment. I know I've talked to many family members who have walked with someone on a mental health journey, and simple things like just having tea with the person, just sitting quietly with them, just being in that space, what we call holding space in clinical terms, is so helpful and so healing, because sometimes it is hard for the person to put into words what they're thinking or what they're feeling, but just being with them in that moment is actually really helpful. Certainly from an employment perspective, expressing to the person that you're concerned, and also letting them know that you have both internal resources at your shop, and Eric did a good job of talking about what Manulife has. That's just one example. Many companies out there have some amazing supports and resources to really help employees work through their feelings and work through whatever challenges that they have. There's also the formal system, and we'll talk about that in a minute as well. If you're really concerned about someone and you need, you've recognized that they need formal help beyond what you think your EAP services might be able to offer or what you might be able to have inside your place of employment, there's also the formal mental health and addiction system that you can connect to as well. The best way to connect to the formal system is through a program that we have here across Waterloo and Wellington County, which is called Here 24/7. We're very, very fortunate to have this program because it's one door into mental health and addictions. I often get this question, I don't know where to start. I don't know who to call. Here 24/7 makes it extremely easy for people to be able to reach out to mental health and addictions. First of all, it's never closed. So it's constantly available, literally 24/7. Christmas Day and New Year's Day, we never, ever close our doors. When you call that number, you get a qualified and trained service coordinator who, first of all, welcomes you and talks to you about what you're struggling with. It might be you're calling for yourself. It might be you're calling for a family member. It might be that you're calling for an employee that you're really, really worried about and you just need some advice. What we do at Here 24/7 is we walk you through what that journey is. We ask questions, we try and get a sense of how big the problem is, and then we help develop a strategy to support that person, again, whether it's yourself or someone else. The other thing that Here 24/7 does is they are that mobile crisis service for our region. So if you are really concerned about someone, so for example, that they are suicidal, and you think that they might do something to harm themselves, Here 24/7 is a great place to call because we will then send one of our workers directly to the place where that person needs to be seen or assessed, or they can come to our office if it's safer for them to do so. So we are the mobile crisis service. We assess people in risk every single day, and it is a vital part of what we do at Here 24/7. Only about 15% of people that we see at Here 24/7 are in crisis. The other 85% are people that are just struggling along that continuum somewhere with a mental health or addiction issue. As part of Here 24/7, we have 12 ministry-funded mental health and addictions providers who offer a whole range of service, from outpatient counseling, treatment, all based in the community, with psychiatry, with nursing, with social work, right through to residential treatment as well for things like addiction, as well as severe mental health conditions as well. So we have the whole continuum available and open for people, and depending on what people need and how significant their concerns are, we match them to the appropriate service. There are waiting lists, unfortunately, for people with mental health and addictions care, but I want to be clear, there is never a wait for anyone that's in crisis. Crisis folks are seen immediately that day. And there are quite a few programs that don't have any wait list. It really just depends on what the program is and what the person's needs are. So if in doubt, call us at Here 24/7. You can call us anonymously. We make it really easy for people to reach out and be connected to care. We've also set up a separate website because of the pandemic, which we are calling Here for Help. So the number 4. If you go to our hereforhelp.ca website, you're going to see a whole host of information relating to how to cope through the pandemic. And we've tailored it for different groups of people. So if you're parents worried about your kids, if your employers worried about your employees, if you're farmers, if you have aging parents, we have coordinated and organized our materials on our Here for Help website, and it's all available to you, and there's all kinds of interactive tools and apps that you can download as well, which are all designed to help more people through the pandemic, more people than we've ever seen before needing help. We've had to get creative around how to help specific groups of people, much more people than we've ever had to get help to in the past. And that's certainly through this website, through webinars that we're doing, as well as through some specific targeted program like Here for Healthcare, which we talked about earlier, being specifically targeted for healthcare workers as well. Bounce Back is a program I wanted to mention, just one example of some really creative programming, which is virtual. You get a you pick a goal for what you want to work on, whether that's anxiety, depression, finding a job, getting your relationship healthier, working through a family stress, whatever it might be. You pick your goal, you get a workbook to work through, and then you get a phone coach, and that phone coach helps you work through those goals and helps you achieve those goals. It's an amazing program. It's free, and you can access it from anywhere in Ontario. That's just one example that I wanted to share with you today of some really cool programming that is really tailored for people to do and receive that help from wherever they are. You don't have to show up at one of our CMHA offices. You don't have to, it's a way to just, protect people's privacy, but make sure that they get the care that they need. There's other kinds of apps as well and websites. These slides are available, so if you want to look at some of those websites, there's some really interesting and cool ways to track your mood, track your coping, track the way you think, the way you feel, which of course helps us manage the new level of anxiety and worry that we have as a result of the pandemic, just on top of the regular stuff that we're managing at work, at home, at school, for aging parents, whatever it might be. You can also visit us online at CMHA. We have a whole host of information as well, and we're happy to answer any questions you have. You can connect to us through cmhaww.ca as well if you need any specific questions answered, on top of calling here 24/7. And the other thing I wanted to let folks know is that we have an amazing promotional and education team here at CMHA. They go into people's employment, places of employment, and they offer workshops. They offer workshops like Mental Health 101 or First Aid for Mental Health. We have some amazing suicide prevention programs called Safe Talk and Assist. Some of you might be aware of those already. So we offer a lot of those programs now. We go into all kinds of employers, and I would say we've had more requests for sessions at work in the past 6 months than we've ever had. So if that's something you're interested in, there's an email address for you to reach out to us, and we can let you know what's available if that's something that you think your employment, place of employment might be helpful to have. All right, I've done enough talking. I'm very happy to answer any questions you might have, whatever that looks like.
All right, I'm just going to come back up here really quick, and I just want to say thank you, Helen, so much for your presentation. So just as a reminder, if you have a question for Helen, please enter it in the chat window to help kick off the live Q&A. I'm actually going to welcome up Eric Pfeiffer back from Manulife, and he's going to start the Q&A quickly.
Yes, perfect. So thanks, Helen, for a great presentation on such an important topic. Thanks for providing those great resources as well. One part of the presentation, you talked about people leaders having a conversation with employees that they feel might be in distress. And that's something we hear about a lot. And it's a difficult conversation to have if you haven't received training.
Yeah.
I think one of the important things, as you mentioned, is they don't have to be a psychiatrist. They don't have to provide a diagnosis. They just have to show their concern, provide some resources. You also notice that we all kind of move through wellness and illness and distress. So one of the questions that we often get from those people leaders is when should I start that conversation? If I notice someone's not doing well today, do I start right away? Do I have to wait 3 weeks? How do you know when you should start that conversation with an employee?
It's a great question, Eric. And certainly in mental health, our advice would be the sooner the better. The sooner you can have that conversation and really invite someone into opening themselves up and just being vulnerable with you, the better it is. The number one weapon we have to fight illness is connecting with people, is sharing those vulnerabilities, is providing that support. That is the number one factor which actually promotes wellness, is having a support system and having people that you're comfortable talking to. Sometimes when people get into a dark space, they're not even aware of it. So the more you can invite someone into a conversation earlier, the better. I think that's the best approach you can do. Now, not everybody's open to it, so that's the other challenge, right? You might open that door and somebody wants to walk through and they're almost relieved that you've noticed and they want to have that conversation with you, which is awesome. And other people, they shut the door very quickly and they don't want you to, they don't want to acknowledge it, they don't want to admit it, they don't want to see it themselves. It's a painful thing for them to look at. And you have to be really careful about that, but come back to it, right? And you can come back really carefully, really thoughtfully, but come back to it. You know, whether it's a week later or 2 weeks later, just say, you know, I'm still here. If there's anything I can do to help, I'm worried about you. I know you want to manage it on your own, but I just want you to know I'm here. You know, you can put a bit of information in their mailbox. Very subtly, like there's lots of things that you can do that just says to the person, I'm here. Ultimately, if they're really not doing well and they're absolutely not open, then it would be actually a great call to call here 24/7 and to ask for people's advice on how to best approach that person, because there are always some individual circumstances which make those calls really more challenging, and getting some advice is actually a great idea at those moments.
Well, that's perfect. That's great advice. And I think having those conversations early and often probably also socializes it and probably helps to reduce stigma, kind of normalize conversations around mental health as well. So
who doesn't
thanks
have a bad day, right? Like everybody has a bad day. Everybody struggles with something. And I think approaching it from a place of vulnerability where, hey, I had a bad week last week as well. I was beside myself. I didn't know what to do. You know, like those are great conversation openers.
Yeah, perfect. Hannah, I'll pass it over to you. I'm sure we have some other questions that have come in.
Yeah, perfect. Thank you so much, Eric. So Helen, how should I know when I should be referring an employee to a formal healthcare service rather than just trying to support them internally?
Great question. And I don't think there's a formula on that. I always like to say, if you have an EAP service within your place of employment, it's always a great place to start. You could send someone to EAP and they can get some support, they can get some counseling. You know, there's usually really good generic counseling available through EAP, and there's some great resources. If you know, however, that there is a really specialized problem that you're really concerned about, first of all, if you know that the person is imminently at risk, obviously, and they're saying things like their life doesn't have any meaning, they don't have any hope, and if you're really worried about that person's safety, that's an immediate call to here 24/7 or to 911 if you're that concerned. But we get calls like that all the time from places of employment around people's personal safety. So that's automatic and a no-brainer. The other ones that you could send our way are if you notice something is quite unusual. So for example, sometimes we've seen people who have a psychotic break when they're at work. And psychosis is actually quite disturbing to see, because somebody isn't able to decipher what is real versus what is imagined. They think the TV is talking to them. They're just not able to sort out reality, and it's actually really quite scary. If it's something that extreme, that's also a call to the to our formal system, right? Those are unusual. They don't happen quite, a lot, but that's where your gut feeling can kick in. If you're really, really concerned about that person and it feels really quite concerning, call us at here 24/7 and we can certainly help out. If it's something that is just, your gut says this person's not doing well and they really need some support, EAP is a great way to channel that.
All right, thank you. Yeah, I think it's really important just for people to know which way to navigate it. So we're just
about EAP and then they call us, right? They've maximize their own internal resources and then they come over to us in the formal system, which is great as well.
For sure. We're just actually almost out of time, so we'll just ask one more quick question. So what is the best way to reduce stigma around mental health at your place of employment? Like often, there's so many programs these days, and I think everywhere we're really trying to reduce that stigma, but on a smaller scale, kind of, how do we do that within our own organization?
Great question, and I love that people want to reduce stigma at their own places of employment, so that's awesome. What I think the best stigma buster is just to make mental health part of the landscape. It's part of the conversations you have at work. It's part of what's on your bulletin board in your staff coffee room. It's part of a fundraiser that you might do as a place of employment. If you know someone is off and they're not doing well, you might rally around and make some meals and support that person. It is something that becomes a conscious part of your culture. So first of all, we're taking care of each other, and we're doing that consciously. And what are the ways that our company can promote wellness? And second of all, we're naming mental health as a goal for our company to get better about, right? So you're taking it from the shadows, you're naming it, you're putting it on the table, and you're developing some specific strategies, first of all, to take care of each other, and second of all, to do something good in our community, which then also promotes mental health in the community. I can't tell you the number of companies that have just called us out of the blue and said, we did a potluck lunch because we wanted to raise money for CMHA services, and we did a soup off and everybody paid $5, and here's an envelope of $150 that we want to donate. Something so simple, so meaningful, and yet the message to your employees is we value your mental health and we value our community. That is amazing, right? It doesn't need to be a big comprehensive strategy. It can be something so simple and so subtle, but it really sends that message to the employees that mental health is so important, and we're going to make it a focus, and we're going to talk about it and really make it part of how we do our work here.
Yeah, that's fantastic, Helen. I just wanted to thank you again so much for coming out today and presenting to our members. This topic is so important, especially now. We've seen it during COVID-19. Yeah, so this kind of brings us to the end of today's sessions. So I just wanted to say thank you again to our title sponsor of the series, Manulife, our platinum sponsor of the series, Immigration Partnership, and this month's presenting sponsor, TD. And last but certainly not least, our speaker today, Helen Fishburn. Finally, I want to say thank you for joining us today to all the attendees. As a reminder, we host a new Business Success Series session every Wednesday at 11 a.m. Next week, we'll be hearing from Andrea Martin with Leslie Warren Design Group, speaking on adapting your social media strategy during COVID. We hope to see you all then. For full details and to register, you can visit our website at greaterkwchamber.com. Please share this series with your friends and colleagues. You can join us every Wednesday morning for the next edition of the Greater KW Chamber of Commerce's Business Success Series, brought to you by our title sponsor, Manulife, Platinum sponsor, Immigration Partnership, Waterloo Region, and September's presenting sponsor, TD Bank. Because it's Wednesday, it's Business Success Series. So thanks so much and have a great day, everybody.
Thank you.